and listen to your abdomen, okay? Okay. Bowel sounds are active in all 4 quadrants. Now palpate your stomach. Alright. Any pain or tenderness?
No.
Okay. I'm gonna have you sit up for me. So during the abdomen inspection and stuff, I listened to her bowel sounds. They were active in all 4 quadrants. Umbilical protrusion was normal for pregnancy. Light palpation, did you have any pain?
No.
No pain during palpation. Her liver palpation her liver was not enlarged. No enlarged spleen. No hernias were noted. Have you had any fetal movement?
No.
You'll normally experience that around 20 weeks. Any vaginal bleeding or leaking?
No.
Okay. And how about any cramping?
No.
Or contractions?
No.
Okay, that's good. It's appropriate for 13 weeks pregnant. All right, now I'm going to be testing your strength, okay?
Okay.
I'm going to do your upper and lower body, and then we're going to do your gait and muscle tone, okay?
Okay.
All right. I'm going to have you put your arms straight out. Don't let me press down. Good. Arms straight out. Don't let me press up. Okay. Now go like this. Don't let me pull. Okay. Don't let me push. Okay. Upper body is all at 2+. Alright. Same thing with your legs. Don't let me pull. Okay. Don't let me push. Alright. Same with your feet. Don't let me push. Okay. And don't let me pull. Good. Muscle tone in lower legs. Okay. Now I'm going to have you do 2+ also. Stand up. And take a few steps forward. And then turn around and come back. And go ahead and sit down. Her gait is steady with no difficulty standing on her own. Muscle tone is adequate. All right. Can I have you lay your arms out like this? Can I have you go in a full circle? And then in the front. Same with your neck. Same with your wrist. Your elbows. Flexion, extension, well. Okay. Your knees. And your feet. All movement from top to bottom without limitations was noted. All right, now I'm going to be doing a neurological assessment. So I'm going to have you stand up, and we're going to do tandem walking, which is heel to toe. Okay. All right. Now I'm going to have you close your eyes and stand there for a minute. Okay, and go ahead and close your eyes and we'll sit down, and then I'm going to have you close your eyes and hold your arms out straight. Alright. So her tandem walking was steady. There was no swaying in your Romberg's test, so that's negative. And you had no plantar drift present. Alright, now I'm going to have you take your finger to your nose. Okay, other finger to your nose. Alright. And then slide your heel down your shin. So your coordination is great, appropriate for your age. There was no shaking. It was steady movements. Now I'm going to be testing your sensation, sharp or dull. So can I have you pull your sleeves up and your legs up, and then close your eyes.
Dull. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull.
Okay. Dull and sharp responses are appropriate, all well and intact. Alright, now I'm going to be checking your reflexes. I'm going to start at your patellar, go to your Achilles, and then do your bicep, tricep, and plantar response. Alright. So, I'm going to take my hammer. Bend your knees at a 90-degree angle. Set your foot down, yep. But let it just lightly, okay? Okay, bend that knee. So, alright. Now I'm going to do this one, your Achilles. Alright, I'm going to feel your foot, okay? Okay. Plantar response is intact. Both reflexes are 2+ reactive. Now I'm going to be doing your bicep and tricep reflexes, okay? Good. 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 All right. Biceps and triceps were all 2+. And well. All right. Now we're going to be testing your cranial nerves. I'm going to have you close your eyes, and I'm going to have you smell this. What scent do you smell?
Vanilla.
Good. All right, and now I'm going to have you stand up and face my chart and tell me what line you can read when you cover your left eye.
D, E, F, P, O, T, E, C, and line 8.
Perfect. Okay. Now can I cover your right eye?
Same line. D, E, F, P, O, T, E, C.
Okay, and I'll uncover both and read the next line down.
L, E, F, O, D, P, C, D.
Okay. Any difficulty?
No.
Any blurriness?
No.
Okay. Go ahead and sit down. All right. I'm going to take my chart down. All right. Now I'm going to have you, I'm going to test your vision acuity, okay? So I'm going to check your 6 fields. I'm going to have you look straight at my nose. All right, here. Tell me if you
Yes. 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 Yes.
all right. All visual is intact. All right. Right now I'm going to have you clench your teeth. All right. And now I'm going to have you close your eyes. Tell me if it's dull or sharp.
Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull.
Perfect. Okay. All right. I'm going to be doing testing your facial cranial nerves. Okay. All right. So can I have you smile? Frown. Clench your teeth. Close your eyes tightly. Open them. All right. All right. Now I'm going to be doing a whisper test on you to check your ears and your hearing, okay? Close your eyes and cover your right ear. Okay.
1, 2.
Good. Now do the same thing with your other.
10, 9.
Okay, perfect. Alright. Now your voice has no hoarseness, but say ah when I have my pen light in your mouth, okay? Okay. Uvula movement is good. Now I'm gonna test your gag reflex, okay? Gag reflex is intact. Very well. Alright, now I'm going to have you shrug your shoulders under my shoulder when I push against them, and then turn your head side to side against my hand. I'm just explaining it to you. Okay, ready? Shrug your shoulders. Good, good. Okay. Good. Movement as well. And then stick out your tongue. It's symmetrical and midline. Alright, that concludes your health exam today. You did a very good job. Your findings were appropriate and well. You identified the smell of vanilla extract. Your visual acuities were normal, and you actually read 20/20, and then you were actually above 1 on your both eye exam. Your facial sensations intact. Your chewing is intact. Facial symmetry as well. Your hearing was good. You identified 1, 2 in your left ear and 10, 9 in your right ear. Your shoulder shrugs are strong. So was your head turns, and your tongue was midline, and your uvula was also midline and had movement when you said ah. Your gag reflex was great. So at this time, I'm going to document my findings on you today, and I will notify the provider for any abnormalities, which you did not have any abnormalities other than you had a few tenderness spots in your breast, which that's normal for pregnancy. No discharge or leaking was noted, but eventually later in your pregnancy, discharge will come. If you have any concerns, you can come back in, but other than that, today your results were within normal limits, and you're healthy for a 25-year-old pregnant lady. Thank you for your participation in this.